One of the things that I wanted to bring up was we've put together a registry and practice guideline approach that looks something like this, that takes various steps. Obviously, a base step is moving from animal models to patients, and that's really what Henry was talking about. We have some basic animal models. We want to start applying that to a few patients. The next step after that would be early patient work as part of research. More patients can be treated in this level, but still closely monitored for any side effects. Treating more patients, opening things up a little bit. And then moving from research to treating patients, the patient numbers start to approach real-world clinical treatment, and then finally treating patients without restrictions. And we actually have here at each one of these steps sort of a certification process for that stem cell line for that application. One of the big problems that we have today in drug development is because drug development is so unbelievably expensive, what we end up with are these firewalls in between companies. Obviously, if it costs $100 or $200 or $300 million to produce a drug candidate, Amgen is not going to share much with Osiris, who is not going to share much with Geron. That's all good from a business plan standpoint, but again, this is what I talked about at the beginning of the conference. That's letting the business plan drive the medicine and not the medicine drive the business plan. So what ends up happening is that all of these things are done sort of in secret and separately, coming out through press releases and sometimes through publication after patents have been filed, etc. But it doesn't really help patients. This whole process, in fact, I think, reduces what's available to patients. It takes people like the Stem Cell Pioneer Group and marginalizes them, because this stuff could happen much quicker if these walls weren't here. So again, the existing competitive system between big biopharma companies is generally bad for patients, in my view. So what we have designed is a very different system, and that is to take down those walls between these groups so that you've got physicians out there who are doing their work, and those physicians have a methodology, i.e. the treatment registry, just like a bone marrow treatment registry, to share that information so that this guy's already done this, he can extend that over to his colleagues. And then those colleagues can obviously build from there and fill in the pieces to go and either treat the same disease or different diseases. And I think this doesn't marginalize patients. I think this actually gets us to clinical solutions as physicians much more quickly and solves one of the major problems of healthcare reform right now, and that is the ridiculous cost associated with producing new drug candidates. So how does all of this work? We have an Icms Registry that we've put together. We've just completed our registry guidelines. There's a physician who can go through that process, license a stem cell technology through that process. This is a professional organization and physician professional registry. Same thing, the technology provider can license that to the physician. Now this may be another physician who's done some work, or it may be someone else. So if you've got a cardiologist who wants to find cells that have been used for a certain type of patient that's delivered a certain way for a certain disease indication, he can go and go through this medical professional registry to find a technology partner who's done that before, who's produced good data. He can search on that data with regard to the safety of the procedure, any efficacy information that might be there, how many patients have been treated or not treated, how new, what stem cell type, etc. ICMS will also provide professional education. So basically physician training and certification, no different than any of the professional societies that you're part of who provide physician education. Live physician mentoring as well for docs that are already doing this kind of work. Lab staff training and certification, obviously, just like the fertility associations now have lab guidelines. They've also got lab training for many of those lab techs. Again, lab mentoring and lab on processes. How do you collect cells? Same thing there. And lab accreditation, we've contracted with Reglera, which is a known entity out there that does this on a day-to-day basis in a lot of other industries. So that's pretty much it for that presentation. In summary, what ICMS is trying to do is to allow physicians to start using stem cells in a safe manner, using professional guidelines to have that happen.